How you doing? Just kind of wondering what you guys are. See, you guys are for the public option.
Yeah, we get the public option.
Okay. Hi, Tony. On the. Oh,
Yeah, that's great. Now, what's your name? Jennifer. Okay.
So you guys are for the government takeover of the medical industry?
That's
For
not what it is,
regulation
but, yeah,
of
you
insurance
need to
passes.
go check out the actual plan before you.
Very. You ever heard of the name Betsy McCoy?
Yes.
The lady that's gone through the bills that are presented now, gone through and kind of explained in layman's terms what this is going to do.
Right, on the from the Tea Party kind of.
No, I don't think she's affiliated. She does more of her. I guess you could say I'm a Tea Party goer. I've been to once here in Jacksonville, once in Orange Park. Kind of don't see many protests. Who are you guys with? Are you with anybody?
What's that?
Are you guys with anybody?
We're representing ourselves.
We're citizens. We're law-abiding, tax-paying citizens. That's good enough for us to be able to speak.
With the
That's
union.
the first. Well, actually, I am with the union, but that's not the reason I'm here for. Yes, I am a union organizer, but I'm not here for that. I'm here to get involved with our community. That's all.
So what about those of us who believe that the government shouldn't control every aspect of our lives through this government intervention they're calling
We
health?
want the public option.
It's not a public option,
Excuse
though.
me, sir. The
Yes,
first thing you need to realize when you're talking about government is that there's no country if there's no government. Period. No country,
understand.
no
I
government.
love the patriots who hate the government. It just doesn't
Exactly.
make much sense to me.
No country, no government. The definition of a country is some entity that is governed by a self-governing entity.
Well, yes, but we live in a. What do we live in?
Okay, what is your problem with that?
If I may, we live in only one of the only 3 countries in the entire globe that does not provide health care
Exactly.
for their people.
Thank God.
Well, that's your opinion.
That's
How many
your
of these countries
opinion
have you lived
because
in?
maybe you
I
have
would
enough
respect that.
money.
How many have I lived in? None.
None. Okay,
But I have
so
gone.
I've lived in
So
10
if-
countries in Europe
Me too.
that all had better healthcare systems than this.
And
So
that's
if you
provided by the state.
Yes,
No, it's-
exactly.
well,
I had a
Government.
brain
The
aneurysm
federal
when I was-
Different
government.
systems, but all of them have a system where you have coverage, right? Whether it's
Through what?
either it's
Through
in
the federal
Switzerland it was
government.
through
How do they
private,
pay for it?
in Switzerland it was through private health
Through my
insurance
tax.
companies,
Through your taxes.
and in Norway it was
You
through.
don't have any say about how it's.
Okay, so
Have you noticed that the insurance costs continue rising at a rate much higher?
let me talk to this young man. I'm sorry. Okay, you want the government out of your life, right?
Some aspects.
Okay, now we agree that some aspect of our lives need to be handled by the government and some left out, right?
But not to the point where it
Well,
is.
I'm not saying. I want to find the common ground between you and me, right? You know that some aspect of your life need to be handled by the government and some aspect left out.
Yes, those enumerated in the Constitution.
So what about
Okay,
Social Security?
exactly. Right to life.
No Social Security?
No, right to life is part of our rights as a human being, right?
That's not enumerated. You're talking
No,
about
no.
the.
No, I'm saying, as a human being, your right to life is a fundamental right, right?
Okay, I'll do that.
Okay, if you have a right to life, how do you expect that right to be handed over to a private company for you to buy it?
It's on your own responsibility.
Okay, I know. What I'm trying to ask you is that if you have that fundamental right, why should it be marketed to the highest bidder?
I don't see what.
Okay.
Okay, see.
Do
Explain
you have
in
parents?
layman
Do you
terms.
have parents?
Do our parents are saying?
Do they have health coverage? Okay, see, I have parents that do not have health coverage.
Well, actually, no. Right now,
And
they
they
stay
get-
home because my stepmom was just laid off from Radio Shack. My dad drives a truck,
All right.
so he has his own. He
Okay.
was covered under her. Now they have to go private.
Now,
until
something
they
was to happen to them between the time that they get health coverage, they're going to think twice whether they actually
would be-
want to go.
They would be covered.
Huh?
They would have. Everybody can get care. We're arguing about the cost of care here, are we not?
The cost of care?
Or is
I'm
that
trying
your
to find out
only
what you're arguing
concern?
about. That's what I'm
Hold
trying
on.
to
Well,
find
I
out.
was trying to
Okay,
make
so
that.
your main problem is the cost of care, right?
No, that's not my main problem. My main
Okay, so
problem is
what's your problem? You said you.
I'm
I was
figure it
trying to
out.
get. I'm trying to.
So he's saying if his parents have some kind of health problem now, they're not going to be covered. So what's going to happen to him? He's going to have to
Cost more.
No, but he's gonna. No, their solution is to. His solution is to go to. I believe a lot of Tea Partiers is that if you get hurt when you don't have insurance, you go to the emergency room.
right. And then the government ends up paying for it anyway.
No,
And it's like 5 times as much as it would
me,
have
you,
been.
the government pays for it, right?
Who pays for the emergency?
Who pays for the emergency room? So the doctor at the emergency room doesn't get paid.
You gotta listen to the point I'm trying to make.
Okay, so you leave it to the doctor or the hospital to make up their own price,
My
right?
point on the
And they
public
charge me and you, right?
option, as you guys like to say,
Okay,
it is
so
not going to
you have
be
not
an
answered-
option.
Okay, you haven't answered
Everything
any
will
of the
have
question
to
we
no,
asked you.
everything will have to go through the healthcare exchange, which is set up by the government.
But the public option is one option out of many. You can still choose to have
No.
private insurance if you
No,
want to.
but
Okay.
the government will set up the regulations and rules that those insurance
Okay,
companies
what's
will have to
wrong with the
abide
government?
by.
Okay,
That's
hold
not the
on.
public option.
What's wrong with the?
No,
Excuse
the
me.
public option is a public run, as a government run insurance company for healthcare. That's what the public
And
Exactly.
that's going to save money?
Yeah,
It's
exactly.
that's going to bring
Provide
down the
coverage.
It's going to bring down the price of all the corrupt
Because
insurance.
let me tell you how it's going to save money. Okay, he is the public option company, and there is Blue Cross and Blue Shield.
And I'm going to steal
And
you,
I'm
rub
the
you
sick.
blind.
No, and I'm sick.
I'm going to rub
Right?
you blind then.
Okay, so I go to him, and he gives me a bill of $20,000.
A lot more
for
than he is.
Not for something small that you could have, done somehow. And then I said, well, look, I can shop around and see if it's still my best option.
Damn that
Then
public
I go
option.
to him.
God, no, I don't
I
like
got
that.
something in my belly here. How much are you going to charge me to remove it?